Joining us, this is the Morning Star, and it's coming to you live and direct from Star TV. And of course, like I said, we were expecting to have SAINABOU. SAINABOU is with us in the studio. Because SAINABOU, yep, your special treatment. Send you the father uti anyway. You're supposed to have special. But anyway, SAINABOU is a project coordinator with the Gambia Health. The Global Health Network, and of course, she is an accomplished, geneticist with a deep commitment to advocating global health and promoting genetic literacy in the Gambia. And she is right now with us in the studio. Good morning. How are you doing?
Good morning. I'm doing okay. How are you doing?
Yeah, I'm fine.
Very okay.
Your Lord of Nunla, Lord of Nunla, Lord of Nunla. Your Lord. So near Samala like Banyaton. Lord of Bada. But we're glad to have you, and we don't anticipate because this topic that we are to talk about is very important. Okay. I'm sure thousands of people out there are definitely watching things that have to do with human genetics, so, and then GISNANJETS and the association as well, the Human Genetics Awareness Association and the like. So can you tell us briefly about this? Start with getting to know what is it exactly.
So to start with, you have human genetics, you mean February donor. Febar bunga hamantene yanko am from Sayak Papa and they pass it on to you. Febar bunga hamantene mungi sen family. So febar bunga hamantene maybe some mom am nako uncle auntie and then the amko. So that is February donor my human genetics. And so I say mamuna tahaw fi nite or mamuna tahaw fi tay rather to explain what human genetics is because I have at least the qualifications to do so.
Yeah.
Right. So I'm now a bachelor's in molecular biology and genetics and a master's in genomic medicine as well from Oxford. So that has allowed me.
Because SAINABOU NDURE an accomplished geneticist with a deep commitment to advancing global health and promoting genetic literacy in her country, the Gambia. Currently serving as project coordinator with the Global Health Network. SAINABOU works on genomics.
Yeah.
Works on genomics project across Africa, contributing to transformative research initiatives in regions. She is also the founder and the chairperson of the Human Genetics Awareness Association, an organization dedicated to raising awareness and disseminating genetic diseases in the Gambia, highlighting her dedication to both science and community advocacy. SAINABOU's academic journey is equally inspiring. She earned her master's degree in genomic medicine from the University of Oxford, having been awarded the prestigious AFOX Mastercard Award, a fully funded scholarship. Prior to this, she completed her bachelor's degree in molecular biology and genetics at Eastern Mediterranean University, and where she graduated as the top student in the development of biological science in July 2020. Congratulations!
Thank you very
wow,
much.
That's impressive. Also on a scholarship.
Yeah.
Her time in the academia not only honed her expertise, but also deepened her passion for human genetics and translational research. So, with hands-on experience in building and managing human genomic database from her time at Oxford, SAINABOU's research also includes work on SARS-CoV-2 during her tenure as a scientist officer in the genomics platform at the Medical Research Council in the Gambia. Her contribution to scientific research are driven by her passion for capacity building, especially within African healthcare and scientist communities. The list goes on. Nananga say that we recommend a strong advocate for women's empowerment and knowledge dissemination, SAINABOU is committed to breaking down barriers in science and healthcare. Her work continues to inspire a new generation of African scientists as she bridges the gap between the global health initiatives and local communities. With all these accolades, Nakala Gambi is celebrating. Have you been celebrated? You need to be celebrated because with all these accolades, this is inspiring. I'm impressed. Huh?
It's an accolade. I mean,
Really?
as long as I get the audience to listen,
Yeah.
because at the end of the day, linga wax ni yep do am ben jering su fekke gene wo mako ci man ma share ko with people.
Exactly.
So that is one of the main things because comme ni ko waxe rek li nga go through non yep man kena suma nekke man kena duma amante
dama da gis time bo so intelligent nga smart trop gaay asabi say this man you na buku man why you are a buku man then yow da nga jël li yep SAINABOU ndaf nga def ba jangal li yep
jang daf ma neex nak lolo thing bi so I love to learn. I like to learn new things and be always janga, always make sure ne ma ngi xam luy xew di seet lan lay yokk si lu ma xam already di seet tam naka lay mën a dimbale ñu nga xamante ne maybe xamuñ or amuñ privilege to be in the same position that I have been nga gis ne dinaa ko mën a share ak guys.
Yeah, before you read some biography, you know, don't start. But briefly, like you said, this Human Genetics Awareness Association being founded because the mission is to raise awareness of the prevalence of genetic diseases in the Gambia, to promote dissemination and to provide psychological support to affected individuals and their families. So this is the mission. Tell us some more.
So dinga gis ne, like you've said already, the main thing moo nekka to raise awareness about genetics, about human genetics. So comme nu ma ko doon waxee before moo nekka feebari doona because dinga gis ne Gambia am na ñeneen ñu nga xamante ne dañ am yenn feebar that xamuñ sax ne genetic disease la mun na am nga assume ne maybe xale bi dafa am rab I'm speaking mostly on children mun na nga gis xale yu nga xam ne dañ foog ne dañ am rab or jine moo leen
ñun loolu lañ déggoon di dafa am rab jine ko jàppa te di mun a am sometimes serious consequences yóbbu xale bi si géej pour sanga ko xam nga jine bi dem tëj ko si néeg bi ak ay saxaar jine bi gën a wax sax fi ko yóbbu fa la koo jële jine yi ci géej gi lañ dikk ak yooyu noonu
waaye xam nga wax bi mooy am not saying ne loolu amut
non dama dañoo assume
am na
dañ dee gis loolu
dañ ko dee gis kay so di nga gis ne que what I'm saying is I'm not dismissing ne what they're saying or luñ nekk di claim moo jot xale bi but lu ma wax moo nekk there's a chance ne xale bi tam genetic disease la mun a and soo xamee ne lii nii maybe disease la nekkut rab bi nekkut jine bi then that's where the psychological support comes in understand because nga gis ne waa koñ bi maybe ñu jàppale la si xale bi ñu dimbale la because most of the time ñu dee am façon xale yi dañ leen di mun a isolate ñu nekk ñoom kenn duñ xam nu ñoo def so at least with knowing that di nga am the support that you need.
That's very true. That's very true. Fan ngeen ci tolloon parce que last time gis naa ngeen am organise benn defin ba yéen a ngi bindoon nit ñi ñëwoon nañu cover event bi and the like. So how far have you gone?
So now what we have done so far is we tried to do courses online. We had a November series, it was a month long, where we taught about human genetics. So it was myself and another colleague from Oxford that did the course. Te bobu no buñ ko defé sa amona ñena doctor ak yena nurse you could attend. And then we got very good feedback from nit ñi because they liked what they got to learn. But the only issue is at the same time afterwards doctors and nurses they reached out and told us okay li ñu jangal is very important because jangal nañu ko waye jangal ñu ko bu baax. So there is also that gap that needs to be filled, and it's also one of the missions of the association to teach nurses, doctors, high school students, university students to try to fill in the gap of this genetic knowledge that's missing. So that's one of our aims as well, and to promote genetic testing because comme ma ko waxee rek doo mën a xam ndax kii ne genetic disease la amoo not su fekkee mënuñ koo test. So it's to promote the inclusion of genetic testing in our facilities and also the creation of a genetic database as well in the country.
But jan façon diseases lañ gën a am as far as genetic deficiency is concerned because man sama laajee tey ak ñu bari liñ ci gën a xam rek mooy sickle cells for example ñu ngi ci fa la ñoo jaare sax jaale suma benn jarbaat parce que dafa gaañu taayale moom dafa amoon sickle cells dafa gaañu dem na ba am 15 years then mu door a gaañ jarbaat la woon ci man ak yooyu so like sickle cells la nit ñi gën a xam.
waaw
but ndax nit ñi war nañu xam ne there are some more different from sickle cells. ak yeneen yoo xam ne mooy li ñu doon wax léegi ne jàpp na yëfi rab la wala yëfi liggéey la wala yëfi nangam pour ñu understand ne lii genetic disease la.
So comme ni nga ko waxee sickle cell is one of the main popular ones. It's very good that it's popular. parce que da gis na comme ni commencé ni ko xam nanka. and nit ñi xam nañ ne léegi soo amee sickle cell or soo fekkee da nga your career or da nga sa family ñu am sickle cell war ngaa dem test to just prevent it in the future. So loolu is very good start. waaye am na yeneen yu nga xamante ne genetics la. So for example am nañ beta thalassemia xal na moo jege sickle cell tuuti because also like similar. am nañ the spinal muscular atrophy. Might be not so famous, but there's another association called the Remembering Rural Foundation, and they're working on something like that. And di nga gis ne boobu noonu dafa nekk feebar bu nga xamante ne xale bi by the time mu am 2 or before mu am 2 mun naa gaañu.
boobu muy waxaat ko muy
spinal muscular atrophy.
Okay.
So da nga gis ne xale bi by the time muy gaañu or before muy gaañu. du mun a toog. du raam du def dara dafa just tëdda rek. So then you say because of cases those are typical ones you need to foog ne rab la because xale bi du def dara.
am na fu ma la war a yóbbu de. I'm serious.
So loolu la
am na fu ma la war a yóbbu am na xale boo xam ne. dinaa try nga gis ko.
Okay.
Because li nga describe nii moo nekk ci xale boobu.
So loolu la dee nekk xale bi dina dem ba 2 like I said most of the time before the age of 2 du toog du raam du dox tëdda rek la because there's a problem with their muscles so duñ dee mën a def dara. So sometimes even send bot yi dañ leen nekk di just move about and you
rawal li nga xam ne yëpp maa ngi gis xale boo xam ne loolu.
so loolu noonu daf dee mën a nekk a typical sign of this one I'm saying and it's one of the ones that most of the time dañ ko dee mën a jaxase ak rab la mbootam mënut a toog or yaay dafa gën a timis moo tax xale bi exactly so that's one of the ones. Another one also moo nekk tëx like deafness. Some of them are genetic as well. I think one of the obvious ones. So that's like a few to name a few. Albinism is one. Albinism is one as well. So like sickle cell is inherited in what we call a recessive pattern. More mean fok yaay bi mu carry disease bi wa affect ko. Papa bi tam mu carry disease bi affect ko ga am doom then xale mu affect. So that deafness as well daf dee mën a nekk the same. So di nga gis yaay buy dégga papa buy dégga nga am doom bu nga xamante ne mi mu te.
doom bi du dégga.
Exactly.
dafa fekk mu ngi woon ci papa bi.
waaye
wala mu
feebaru
ngi woon ci yaay bi.
te affect
waaye feeñu toon.
so
xale bi ñëw génn feeñal ko.
xale bi ñëw feeñal ko.
so
albinism tam is the same thing.
mooy puuna.
waaw
waaye pour mu leer gars yi.
non pour mu leer waaye xam nga
war a xam nga xam nga la.
lu dee xew rek moo nekk
suma joolaa bi xëy na xamul albino.
waaw ok
albino mooy puuna.
xam naa
waaw pour mu leer.
waaye xam nga luy wax bi mooy waruma ndax puuna is a word that they want to be called is it.
non waaw you're right.
so loolu moo tax I am a bit.
non dafa wax nga dëgg sax par ma dimbale la parce que people living with disability. You don't call them.
They're
disabled.
Well,
you just call a person with disability.
People living with disability. People with visually impaired person or something. But puna, how ma leruma. But hamnani, we can use it for now. Puna you understand it. That's what we mean by albinism. Because you create awareness. So even soon can you get jigalu? Why fogu mo kosane? Fogu mane what you get jigalu? But li la chimin. Can you get jana jangal? Puna you mo understand. Wow.
So boobu noonu time is one of the genetic diseases. So dafa nekk lu nga xamante ne feeñut si yaay bi feeñut si papa bi and then mu feeñ si doom bi.
ma bëgg la ci laaj am solo parce que léegi-léegi ma dégg gars yi di wax deret bu jege lool daf dee cause genetic disease yi nii. How true is this? ñu bari gëmuñ ko. surtout am na yenn xeet yoo xam ne ci réew mi fii. ñoom lañ gën a xamee ci sëy yu jege yooyu noonu. li ci mel ni saraxule li ci mel ni pôl li ci mel ñëpp a ko dee def nag. am na ñoo xam ne lii dañ leen ko xamee but jege-jege bi mooy. comme ñu bari soo leen ne dafa jege dañaa de ok doomi nijaay doomi bàjjen ñu ne jegewut wala nga gis kii ak kii ñaari jigéen lañ ñoo bokk ndeya bàyyi seen doom yi sëy booboo gën a jege wala ñaari papa seen papa yi bokk ndeya bàyyi ngeen sëy booboo gën a jege daan doomi nijaay doomi bàjjen loolu lañ ko dee gisee but dem nag ñëw na yëpp ndax dëgg la ne deret yu jege yooyu noonu daf dee cause genetic disease.
No, dëgg la. It's true. Because li xew mooy in order pour ñu mën a xam nit ki ban genetic disease nga am foog ñu xam sa DNA. So DNA is in every cell sa yaram bi. So dafa mel ni instruction manual for your body. So sa yaram bi lu mu war a xam yëpp sa bët ci nuñ war a mel sa skin bi color bi sa kawar bi yëpp is in your DNA code for example. That's what it's called. So léegi yow soo amee sa DNA code nga dem si ak nga xamante ne dafa jege ak yow torop daf dee similar a lot. so similarity boobu noonu so leen sëyee su fekkee kenn ki for exemple mu ngi am benn feebar feeñut kan ñu ko doon waxee keneen ki tam ñëw mu ngi am the same thing ngeen sëy because of ni ngeen jegeñee feebar bi daf dee mën a gën a garaaw because of that closeness. So it's called consanguinity, I believe it's pronounced.
Okay.
So if they gonna grawal fever, but fata fever the far fein. Because if I can yo sa family, you know a disease bunga hamantene and ko carry te fenyut, right? You them say like benen family, maybe you amuñ ko tanga du feñ. Waaye su fekkee da nga say biir family bi te yéen am ngeen feebar boobu noonu dafa tax feebar dafa gën a gaaw a feeñ.
dafa gaaw a feeñ.
so loolu am dee nekk nag it causes it to be more severe mu gën a gaaw a wane.
Interesting. Do you have questions balaa maa ñëwaat parce que man moom mën naa toog fi di ko laaj fii ba ëllëg.
Man, I just want to add on to because it's something very educative. So it's not in our Gambian society full of the issue of this genetic issue. Because most of the time, most of them they want to come maybe when I say we're gonna have some genetic test and you know. So how important is that? Because most of the time need to very full of go with regards to come but I say we're gonna have some genetic tests and have not you are compatible or no for them. So yen as an association, naka ngeen nekk develop lu mëna gis ne you can make people aware of such issues.
So from nekani belegi again we're doing most of the things online, right? But then the target is to actually go into the rural areas. So this coming on this talk is one of those things that we hope can actually make a little bit of a difference and then actually go on radio stations like you know. But then to go back to the genetic testing, to do a genetic test, let's say currently in Gambia, hamna am nañu test sickle cell. By February bari nañ torop. Okay. So unless mo nek li nga xamantene maybe family bi xamé ngeen ko and ñu bëgg dem test, that's great. But the brain problem mo nek ndax ñu ko testangom biir Gambia. Okay. But then that's again one of the things that we want to promote to be done here. But so if that facility is not available, comme man ko doon wax moo nekk li nga def mooy pour ñu nga xamante ne mënuñoo am that ability nga xool family bi nga bëgg a def seyal okay so da nga xool family bi nga xool as far as seen maam yi seen maamati maam yi what do you think moo nekk a pattern in this family right so fekkee ñoom dañ di am maybe ndiga bu métti bu bari maybe auntie bi uncle bi maam bi dañ di am some diseases that you see waa kër bi moom or waa family bi entirely maybe they have let's say something like sickle cell then so fekkee mënuloo ko test sax di nga xam ne okay maybe there's something here so fekkee you have no issue you can look into things like that so fekkee you don't have the ability to test so that's one way bi nga mën a you know gauge the field balaa nga say because so fekkee da nga family bu nga xamante ne maybe da ngeen am ndiga bu métti nga bëgg a dem see beneen family bu nga xamante ne they have something similar it might not be the wisest thing understand because loolu moom mi ne maybe ngeen am a child maybe kooku ndiga bu métti will be even worse than yéen li ngeen nekk di jàmbat so that's just one of the examples and I'm using ndiga bu métti because it's the you know it's one of the things I can gauge but more things than that more things like that.
Okay.
I
have actually two questions. So what are some of the specific goals you aim to achieve as an association?
So one aside from the one we've already said about stigmatization and awareness and providing psychological support for the affected people, Monica will include this genetic testing in the healthcare system. Understand? Because I'm not fair to talk about what they've test, but so I'm definitely not tested in a halamiti. So it will be to include this genetic testing in our facilities, that's one. But also to have a database for it. Because so if on a database, it could be an amna and I don't know about it just yet. I could have just tapped into that and like, okay, Gambia Fidi, yan your neck at the top 5 or top 10 genetic diseases you neck at your report. Then I would just talk about those. Because I have not or I'm yet to tap into that we want to promote the creation of that database in the country. So that's another thing. Okay. And then the other thing is to provide the education. So the awareness is one thing, it's another thing to actually teach the people, you know, the nurses, teach the doctors, teach people responsible for other people about human genetics.
Alright, as the project coordinator, what else have you ever worked on projects or are you planning to work on projects and how will these projects impact on the life of the public?
Are you saying in reference to human genetics and the association, or as the work, a job?
The work in general.
So with my work as a project coordinator for the Global Health Network, we have not yet done a human genetics project.
Okay.
We have done genetics projects like genomics. So we have done like wastewater surveillance to see young diseases ñoo nekk ci wastewater pour mëna xam lan mo nekk ci population bi. That's one. Another thing would be to test, let's say, flights of people arriving, SARS-CoV, as well. We work on those type of data. But then, those, Marvel as a project coordinator, I've not used that yet, at least do human genetics projects.
Oh, okay. All right. Thank you.
Living interesting. Interesting. Because mangi so try to say it and then I realize chronic pancreatitis mangoges as far as genetic disease is concerned. And most interestingly as well, mangi is malaria. How how significantly that influence in individual susceptibility to malaria?
So the malaria one is a bit of a tricky one because, so malaria, if you're infected, it goes to your red blood cells, if I'm not mistaken, and people are more reproducing and it spreads out. If you are a sickle cell patient, for example, you might not be prone to getting malaria because the shape of the typical red blood cell, which is round, they changed to like a C. So boron do they bapple malaria parasite way. So then you're likely not gonna get it because the gonna spread and it's the same if you are a sickle cell carrier. Let's say I am a sickle cell carrier, most of my malaria. Because some of my red blood cells are okay, but the other half of them, then I'm that sickle shape, like a C. So bapple malaria parasite be so do my malaria. So they gonna reproduce buba. Which is different from who healthy and your red blood cells fine.
So you didn't have malaria?
But most of my malaria, man. So I'm not saying it's never gonna happen. It could happen, but then it's very unlikely. Your chances are very low if you're a sickle cell carrier.
Follow you have for nekere.
No, I am very. Nobody worry about yourself because I'm not seeing
no, yo guri ñola de mata. Yo jigen ñu maton diga malé.
No, trust me, tay sama non ko to me xamna mo yoy massa dañ wadi mom na.
Wa yu guri la dañ nabaté. Ñu jekk na rek ñu wala. Su do ñoy jigen ni la. Ah, ma jaxal na ma de. Ma nga do gis ku ma ne musuma am malaria.
No, trust me. Even time xalé dama daan bëgg am malaria just so I go to the hospital, comme xalé li ñu daan def ñu sé leen juice ak chips. Dama daan dem pour yoy mata be so dara. So at least when I grew up, I found out why.
Can you tell us why again? Because this is interesting.
And so again, it goes back to your blood cell type, right? So normal human beings, normal hemoglobin, Monica, the molecule that carries oxygen around your body, is a round shape. Okay, more normal hemoglobin. So I made sickle cell. Instead of Monica the normal round, if I make like a C shape.
Yeah.
So more come with the blocks and arteries again and mated and so many other things because structure is completely different.
Yeah.
So if you're AS, like a sickle cell carrier, you have both the good one and the sickle cell one.
Yes.
So the now malaria parasite needs that space in the healthy one to be able to go through all the stages you want to reproduce.
Yeah.
So it needs all of them to be healthy and very good so that it can manifest in there. Now, if you have the sickle one, there's a chance that the environment is not very feasible for grow because you're not providing that environment they need. Understand?
Exactly.
So they're gonna grow.
Yeah.
So if you carrier come you have so be for them to spread very well.
Okay.
So there's a low chance that they get malaria. Not that they don't have malaria ever, I'm not saying that, but the chances are slimmer.
That's slim. So how about chronic pancreatitis?
So at the top of my head, I can't tell you much about chronic pancreatitis. I would have had to read up about it and then give you a bit more information about it. But to substitute for that one, you can look at kidney disease. Because kidney failure kidney issues. So there's one that is has some genetic aspects of it. I think it's called APOP1 gene. That's the gene that's usually looked into. So both it's genetic as well. So you can test for that to see your susceptibility. And yesterday I had another one, breast cancer. Breast cancer is another genetic disease that you can inherit. So they can check for it's called the BRCA1 or BRCA2 gene. And that inheriting a bone on time, and that one you can get tested for.
Some of these diseases, what is paramount is counseling and psychological support. That I'm the cure. Not some of these things I'm the cure.
Yes,
that you only rely on the counseling and the psychological support.
So that's the difficult thing about human genetics, to be very honest. Currently, I would say currently, because in the future, it will be easier to find cures that we can do these things. Because what will happen is then they will create maybe a vector or something with the basic DNA will change error. So like I was saying, DNA is like an instruction manual. So let's say it's A. So if I say that because they could replicate from parent to child, we couldn't copy. The mistake instead of AAA, we have AAS. Error.
Yeah.
So error with you can tolerate in different ways. So if it's in a very important region, then you will have a genetic disease which is very serious.
Wow.
So if you tolerate, maybe do one okay. Or if you tolerate completely, then it's fine. So that's the other thing. So now also because of that depends on how can you cure it. It's very expensive to find some of these therapies. I read up about sickle cell that they were trying to find an intervention for, but the asking price was around $1 million.
Wow.
But then it worked for some time. I'm yet to do a follow-up to see how that patient is doing now. But I guess on nane symptoms at least.
So what is the situation in the Gambia? Is some of these things, is it on the rise, or with your advocacy programs and FOC, is it going down, or we get serious with more cases coming out?
So for one, we would need to test it first in order to give you the answer.
What do
they
have in their system? What's in the data?
So that's the other thing. So I asked a couple of my friends that are doctors and nurses, and they were because we test a definitive answer for sure.
Okay.
So maybe with experience, but because we're not going to test fee, okay, definitely understand. So that is one of the things that we need to work on, like I was saying earlier.
That's important. You get run out of time from nekani because lead of important sa ñew mom ñew bi dafa am solo parce que nit ñi dañu wara xam ni yaa ngi fi loo xam ne ñu bari xamuñ ko woon surtout dara bu jege bi jeexoon nii parce que léegi nit ñi di ko werante non loolu defi yàlla la ak nangam waaye dëgg la yëfi yàlla la waaye tam dafa am loo xam ne lii ak lii moo ko waral. So waaw nit ñi moom it's important pour nit ñi understand. But
and sorry not to break you in, but nga gis ne if there's a lot of studies, research that has been done, see relatedness when it comes to genetic disease, and all of them show relatedness that they matter.
Yeah.
The more close you are, the higher the chance of the disease manifesting, because mung sen family mung sen direct bebe pare. So len say dafa gëna yoma pour mo wone compared to so sorry to
ba suñu waxtaan bi du tax am ñaar ñu break waja sey te ñu ngi nekk suñu direct leen jóge. We're not saying that. We're saying that mun na possible. It is a possibility.
Okay. So we're just saying especially if family bu nga xamantene maybe am na disease bu fa nekk.
Yeah.
So just ñu jéema moytu rek, but su fekkee ne dem na ba happen na ba pare lu ñu mën a def mooy you can try for IVF. Okay.
Which is?
So IVF it's a procedure where you go to the hospital as the woman and they harvest your eggs. So they will extract your eggs. I don't know what to substitute for it. I want to maybe baby sujudongut or something, but they take it out and then scan.
Scan?
Yeah, the egg.
The egg, sorry.
Yeah, so then your whole DNA without any mutation, everything is perfect. Ben fever nekofa, or I'm not specific fever begin add down. And then they choose those ones. Then they put it back into the woman. You fertilize you fertilize with the male. And you deal from juge. So it's a very common procedure now. No trust.
li ci nekk dafa delloowaat egg ci biir.
Okay. Don't you guys know about like that? Xam ngeen ko ci.
Dégg naa ko sa bopp. Ñi dafa intéressé. Waay loolu nan la mën a neexee.
No, but you know, it's very common now. Many people knew these genetic conditions, especially in their families. That is one way to prevent it.
Yep.
Because let's say a typical example, sickle cell. Nyari carriers, you say. I'm not encouraging it, by the way. Why nyari carriers, you say, and you just want to make sure, amulen a child with sickle cell, right? So you would go, you harvest eggs, you test, you get okay, this particular one, maybe this 5 or so, that mutation, that error, it's DNA, maybe. Then you will guide use, combine with the male sperm, and then put it back into the lady. So it will be successfully, it will be a pregnancy, and then the child would not.
They
do it in the lab. It's a lab.
Why Edward B?
Ci lab bi.
Okay, ci lab. No. It's
a very it's
am na ñoo xam ne foog nañ ne loolu mënut a am. Foog nañ ne fu doom juddoo rek xamal ne baay jee yéeg ci kaw yaay moo jëflante yaay ji.
Okay.
xamuñ ne papa bi mun naa toog base kii toog kudang xaw ma kudang ñu yàlla dogal waaw.
But I mean they need to have the products again.
Products rek lañ need pour ñu def loolu.
Yeah, and then they need the woman to put it back into unless they want to use a surrogate as well. But no,
jàmbaar nga kontaan. Thank you so very much. Because I wish when you Amar on this platform, to be honest. You know, I'll gonna yatal watan because this is very important, and I'm sure many people have learned something new today.
I hope so.
Even my colleagues have. I'm not lawyers as well. But so what's coming up now? Because you get this awareness campaign, and then you get to them. Get them to up countries, and is there anything on the pipeline? Things that's about to happen?
So them going up country, and we want to collaborate to do that. So
important. That is important.
So that is very important.
They need to know about this.
Exactly. So the next step what we are working on is to try to propose to the government to see how we can collaborate together to have these sensitization movements, I would call them. Understand? Them see there be
exactly.
And then also at the same time actually nurses, actually doctors, because if they come to them. So they need to know what is happening to it. So to doctors, the nurses, which goes back to teaching teach university, we teach doctors, we teach nurses, but also to go to the rural areas. So that goes back to collaboration, because we can't at all. So we are also seeking collaboration, seeking partnerships, external and local as well, just to get this done. And also, like I was saying earlier, that the database, the psychological support, because as an association, now, or let me say for now, we cannot give that psychological support just yet.
Okay.
So we need that expertise. I'm not a psychologist, but to do that, you need qualified psychologists to provide that. So these are all collaborations that we need to foster and partnerships we need to do.
Oh, thank you so very much. Thank you for coming. Future again to give us more information. Last time you were but right now
I'm hopeful that's going to be the case.
Thank you so much. All right, that was SAINABOU NDURE, the project coordinator with the Global Health Network, and she's an accomplished geneticist with a deep commitment to advancing global health and promoting genetic literacy in the Gambia. We thank her for coming, and we wish you the very best of luck in all